Okay. So, can you tell us what right skilling is and how it differs from upskilling?
I'm being asked this question a lot since right skilling is one among other core differentiators that makes Meta Counsel stand apart.
Mm.
So, let me explain this with an analogy, something that is relatable. I had this really very interesting experience yesterday that
Okay.
beautifully highlighted the immense significance that right skilling has and how it can be a game changer in any sphere of life.
Mm.
So I was at this friend's place whose daughter is training to be a chef. So, as expected, this young lady has learned the basics of, chopping, frying, stewing, sauteing, and has, gone in for upskilling through, learning all these different cuisines like making Mexican food, Thai food, continental food, etc. So, she was setting up a cheese platter for us and had different types of cheese and fruits, dips, etc. So she asked her mom to fetch her a knife to cut some cheese. Now, the mom got her a knife, and according to her mom, a knife is a knife, right? So our lovely young chef protested, saying, "Mom, this is not a cheese knife." And her mom insisted that the knife she had brought could cut vegetables. So should there be, there should be no reason why it could not be used for slicing the cheese.
Right.
Then followed a short masterclass for us, wherein we were gently informed that it's important to get the right knife for the right purpose. And why so? Because, for she said for precision, to prevent wastage, for proper portioning, for efficiency and effectiveness. She was like, a bread knife is to be used for bread, a boning knife for meat preparations, or a paring knife for peeling and trimming, and carving knives, etc., etc. And so, I was just thinking a trained chef or anyone who's trained will always use the right tool, like in this case, the right knife. And similarly, a trained professional has to use the right tools and right interventions. So learning to use the right tools and skills in the right places enhances not just the efficiency, but also the effectiveness. And that's exactly what right skilling is in mental health also. In fact, it's not as simplistic as the knife analogy because, look, in mental health, our objective is to help people in problem management and in opportunity development. But each individual who comes to us is different. Each individual's experiences are different because, the emotion behind the experience could be a bit different. And even if the emotion is the same, the thoughts leading to the emotions can be different. So you've really got to be on top of your game to be able to pull out the right skills that work for that person in that situation. And, also tools and protocols, that are, for example, used for children. Sometimes people get into this kind of a reductionist approach that, they tend to look as children as reduced thumb-sized versions of adults. And that's how they dilute the tools. And that's not the right thing to do. So, yeah, that's what the right skilling is all about. And upskilling was when I gave this analogy of learning different types of cuisines. So, similarly, learning different methodologies in mental health, in counseling, in therapy is upskilling.
Okay. So, that was a great analogy. What steps should one take to begin right skilling in their career?
Well, let me see. If it's a young professional, then I would like to rewind the clock a little. Then I would say first identify your interest and aptitude and figure out which branch of psychology you would like to hone your skills in. That's where I would go first. Now, having said that, please find yourself a mentor who has expertise in facilitation, and is not merely a brilliant teacher or a great trainer or an academician. What I mean by that is someone who does not only teach and train, but is also a practicing therapist. Teaching skills, and especially the right skills, requires a lot of practiced expertise. Just the same way, I mean, you cannot learn swimming online, right? Similarly, in the mental health space, you cannot merely get away with knowing the theory. So, firstly, you've got to undergo experiential training wherein you take a deep dive and experience what it feels like to be vulnerable, to be drowning. And also, only then do you know what your client is going through. I mean, empathy is, is not something which is, which comes from the head. You know, and I mean, can you imagine the outcome if there was someone drowning in a pool with one of us shouting out step by step instructions from a manual or a PowerPoint presentation on how to save themselves? So that doesn't work. And secondly, you've got to practice and train with someone who has experience in face to face counseling. I mean, that's very important. And please, you have to take supervision. You cannot learn skills and do therapy without supervision.
Course. Yeah, that makes a lot of sense. So, why is right skilling particularly important in the field of mental health?
Sukriti, that's a really pertinent question because, do you know if you look at data, and this is data for India, about 57% of clients discontinue therapy after the first session. And data also indicates that from among the remaining who do go in for the sessions, almost 40% of them drop out after the first few sessions. So clearly, there is something right that is missing. I would not like to call it wrong or give it a good or a bad label, but something that is being done that is either rendering people ineffective or compromising on their efficiency. You know,
Mm,
um, look, so mental health professionals operate in a space that is dynamic. It is, the space is in a constant state of flux. And we cannot afford to rest on laurels or degrees or trainings that we underwent 10 years back, leave alone earlier than 10 years back. And so we have,
mm,
we have two very important goals as service providers in this space. Firstly, to
mm,
ensure that we are equipped with the latest skills. And for that, we need upskilling all the time. And secondly, that we are, updated with the most appropriate or the right skills and tools. And that's what is our focus at Meta Counsel. I mean, if you want, I could explain this with an example of, how right skilling involves pinpointing and, mastering specific therapeutic approaches that, align precisely with the, unique challenges our clients face. And it's very, very unique. And, this I would say is very, very important. See, look, when a client comes to us, like if there's a client who comes to me, I mean, there is there's never a one single problem. Oftentimes there is a lot of overlap. So say I have a client coming to me with a relationship problem. Then
mm,
as a therapist, in order to be effective, I will not use the straightforward tools and techniques with him or her, but use very, very specific paradoxical tools and techniques, which are going to be the right tools and techniques for that situation. Now, also, like in all probability, if the person is grappling with a relationship problem, I mean, in all probability, like I said, the person might also be depressed or may even be anxious, about the future. So then I will use only my cognitive tools there and maybe use some uncovering techniques for anxiety, Suppose there's also an addiction issue, because I was just thinking of this client of mine, and there is a relationship problem with an addiction issue, then I will use a habit and addiction log as opposed to merely staying with a mood log. And I will focus on addressing positive distortions as opposed to only negative distortions. So, these are the right tools to be used at the right time, at the right place, for the right reasons. The other thing that comes to mind is that adult tools will not work for children. If they are overwhelmed and they are triggered, you know how it is with children. I mean, they get just so overwhelmed, they flip the lid. And you have to first use somatic tools to address overwhelm before you move towards making any kind of therapeutic intervention. So, yeah, it's about having the right tools in your therapeutic toolkit, tailor made for specific conditions. Yeah.
That's a great example of right skilling in mental health. What challenges do mental health professionals face when it comes to right skilling? And how can these challenges be overcome?
Well, look, there are lots of tools, but sadly, most people are not trained to club together the tools to be used to seamlessly flow in and out when they're being used. I mean, in a session, you've got to be in flow. Today, doing therapy is almost like, like the navigation system in your GPS. So for example, your GPS has a method. There's a process it follows, right?
Mm.
The roadmap has already been charted out. It's tried and tested. Similarly, it's very, very important to have a roadmap or a framework for therapy too,
Mm.
which is again something that differentiates us at Meta Counsel. Maybe I could elaborate on this a little. So, uh, on the framework, for example, in the framework that I use for making interventions, the I include strategies like the uncovering technique, the basic techniques, the motivational strategies, the interpersonal strategies, the cognitive strategies, exposure based strategies, spiritual strategies, humor based strategies, etc. And having so much ammunition in our arsenal helps us or me to identify and pull out the right skills and tools to address issues the clients would come up with. So, I mean, I remember there was one time when somebody had said, and I really found it very interesting when I was a young therapist, that if the only tool in your toolkit is a hammer, then you'll treat every problem as a nail and you're going to hammer it down, right? So, so we have more than 100 different right skills and tools. Now, for example, and if I say 100, then I just named some 7, 8 strategies. Now, under that comes, so for example, under the cognitive strategies, we have techniques like the compassion-based techniques, which have there we have truth-based techniques. We also, in the uncovering strategies, we have individual downward arrow, interpersonal downward arrow, the what if technique, and so on and so forth. And it takes us to 100. We have the luxury of using 100 different tools and finding and identifying the right one. But there's one disclaimer I want to put in here. If you have to be trained in all the steps and stages of the protocol to reach the strategic intervention stage, because you have to begin with melting away client resistance first. So why I'm kind of saying this, throwing in this caveat, is because you may come across some of the tools I have named in books or the internet or whatever. Setting up therapy is very, very nuanced and layered, and you can't just jump into methods and tools without having laid out, prepared the terrain and the ground, so to speak. Yeah.
Right, what you said is so important. And on that note, I would like to understand, how is Meta Counsel helping students and young professionals in the field of mental health to right skill effectively?
Okay. At Meta Council, the entire protocol that we follow is focused on upskilling, is focused on deliberate practice, is focused on relapse prevention, where we prepare our clients to manage relapse, because if they're living life out there, they're bound to have another dose of, feeling low or anxious or, whatever. I mean, that's so common. And of course, right skilling. So these are some things which are our forte, and those are our, those are things which differentiate us from others. Our philosophy is based on moving away from a DSM driven, disorder focused lens of what is wrong with the client. And instead, we like to highlight and acknowledge what is actually right with the client. Is everything right with all of us? We're all, and we have to normalize people feeling anxious or depressed or not, or lonely or slipping into behavioral addiction or interpersonal problems. That doesn't mean there's something wrong with you, you know? And the beauty of it is that at Meta Council, we have the luxury of using more than 100+ tools in our toolkit. And we train and teach people to identify the right skills through the rigorous practice we put them through. And we have skilled practicing therapists as trainers, not merely people who are trainers or academicians. And this is how we're different. And this is what we're doing differently.
Yeah, that's such a wonderful approach to mental health. And what advice would you give to young professionals and students preparing to enter the workforce?
Okay. um, what advice would I like to give to young professionals? See, firstly, please invest in learning. Don't be in a rush. Till there are people on this planet, there are going to be problems. And like I said, it is normal to have problems. And your skills as a professional, as a psychologist, as a therapist will be needed and valued till the time there is life on earth. Now, as long as you have invested time and energy in honing these skills and can help make that difference in people's lives, you know what? After 20 years of teaching therapy, practicing it in sessions, as well as training people, 20 years of it, right? I felt there was something missing. Something more was needed. And like I said earlier, it's such a dynamic space, right? And so I resumed learning the new modalities from 2019 onwards. And of course, it's been challenging because if you have a 20-year background before you, you have to unlearn a lot and then to get into new learning. Plus, I had to travel and be in another country. And then when I was back here during COVID, I would operate on international timelines. But believe you me, it's been so worth the time and energy because I feel confident about my skills and abilities to help resolve the current day challenges. Everything is being updated. Look at the way your phones get updated regularly. Why, for God's sake, shouldn't the skills, the methodologies, the modalities that we use be updated, upgraded? And it's so important that we bring in the new skills and the right skills. And today at Meta Council, we bring these tools and techniques to our learners at, 1/5 the price that I paid when I was learning all this overseas. So that's the first thing. The second point that I would like to make in terms of giving advice is don't be in a rush to jump into doing therapy without continued training and supervision. Not only will you feel stuck and start giving advice like everyone else, you will also do an immense amount of damage to your clients and to
Mm,
the profession at large. I mean, our clients come to us with expectations beyond what is being offered to them by friends and family or by movie stars and influencers and through Instagram, TikTok. I mean, everywhere there is, mental health advice being given. How are you different? What are you
mm,
bringing to the table that is going to be different? Please invest in yourself. And you're going to be the person who's going to be a game changer, right? The third thing I would like to say is don't be scared to be honest. We've got to be authentic people. That has to be a way of life, in my opinion. If you think you do not have the skill set to help a client, it's okay to let them know that. It's okay to refer them out, you know. I mean, I personally still jump at every opportunity I get to undergo training that adds value to my skills, not just any random training for the sake of doing training or for the sake of undergoing training. I definitely research my trainers, the skills that I will be learning, etc., etc. And I am proud to say that I'm still learning and I'm still willing to fail every day in my learning sessions. You know, I mean, we only fall or fail forward in life. We never fail backwards, you know. And yeah, I mean, there are times when I feel stuck. So supervision is very important. I would also recommend that people should not uh, keep clients dangling with all kinds of, and I see this often, you know, I see this, all kinds of rescue protocols or band-aid therapy. That's not our role.
Yeah.
And as a trained professional, you're bound to do that instinctively when you see yourself struggling and when you feel helpless and you don't know how to proceed. It's a knee jerk reaction, and you will start giving advice. You'll start doing everything that, um, you think is going to help the client. We're not there to help the client in that way. You know, we have to empower the client. We are enablers, right? So that is something important that we have to remember.
Yeah. What you said about not being in a rush and failing forward really resonated with me the most.
Yeah.
And like all these advices that you've given out are amazing. To end our conversation, is there anything else you'd like to put out for our audience?
I would like to insist that people go in for evidence-based therapeutic modalities. You know, like so. When I was doing my masters, I did a lot of different kinds of modalities. Like, for example, there was we did client-centered therapy. We did transactional analysis, family therapy. There was the psychoanalytical school. We did things like behavior modification, and all of those are very, very important. But today we have a lot of evidence-based therapeutic modalities, and these are treatments that have been scientifically tested and proven to be effective through all kinds of rigorous research and clinical trials. um, Also, I would say that it's very important because these therapies are supported by empirical evidence demonstrating their efficacy in treating very, very specific mental health conditions. I mean, you always have the right skills with them. In fact, the term evidence based indicates that a therapy has undergone systematic and objective evaluation, and often what are those called? Through randomized control trials, through meta analysis and peer reviewed studies, and all of this helps in establishing the effectiveness of these modalities. So I would say just focus on evidence based modalities in learning those, and that will really that will really, really help you. And the other thing is, it's very important to have a framework in therapy. For example, I have a basic framework which is a team CBT framework, and in that I pull in, so everyone talks about being eclectic, so in that I pull in different tools and different techniques from different modalities, which means that it's important to not form a cult and say my form of therapy is the best. It's important to respect that respect the fact that all modalities bring in something of value, and to, as I said, you to seamlessly flow in and out, but have a basic framework. That's very, very important.
Thank you so much for taking the time and giving us all these amazing insights today.
Thank you.